Having a baby is a physical, emotional, sometimes spiritual experience. You will not be going through the file box of your mind or flipping through these pages. Partners, you're not having uterine contractions. You will be able to go through this book and have it be meaningful to you. Starting right off the bat, please join me on page 12. On page 12, there we have it, position of baby. The baby needs to be in a head-down vertex position. In order to be a vaginal birth, the baby must be head down. They're going to be confirming that at about 36 weeks. At 36 weeks, if the baby's head is not down, if the baby is breech or transverse, they'll talk with you about having a version external maneuver done in the hospital to help move that baby's head down, to increase the chances that you will have a vaginal birth. I also think that acupuncture can be very helpful. Partners, underline that. Bottom of page 12. You may want to discuss acupuncture. Helpful in inverting babies into the head down position. People, the head is the biggest part of the baby. It is obligated to come first. It needs all those hours to be able to mold into something that looks like a Saturday Night Live cone head. The bony plates in this skull are not fused yet. When the head comes first and it comes through the bony pelvis, through the vagina, it often goes into a point. Sometimes it looks sort of like a summer squash and sort of lifts over to this side. That's when you want to leave the baby beanie on a couple extra days until the head kind of rounds out, which it will. But that's why the head's got to come first. They're not going to have a vaginal birth with a breech baby. So a version or acupuncture will be good efforts to help get that baby lined up. Okay, good. Next page. Page 13. How many moms in this room are beyond 36 weeks? Let me see your hands. Beyond 36. Okay, so all of you are under 36 weeks of pregnancy. That means that you're all falling on the left-hand graphic, top of page 13. Terminology, next few pages, starting right here, I really want you to be familiar with the terms. When you know the lingo, when you understand the process, you can then dialogue with your doctors and midwives for the rest of the pregnancy during prenatal visits, and particularly the day of delivery. When you know what's going on, you can become part of the decision making, part of the conversation. So I want to spend a few minutes on these terms to really give you a sense of what's going to go on that day. First term, dropping or lightening. Today, moms, your babies are riding high. They're up here, putting pressure on the diaphragm, stomach, can't breathe, digest too well. As you approach 36 weeks, the babies start to drop or lighten off the diaphragm directly onto your bladder. Take a look at these graphics. Left-hand side, check out the bladder. We've labeled it for you. That is one happy-looking bladder. After 36 or so weeks, take a look at what happens. The baby has dropped and it's sitting directly on the bladder. The bladder gets very irritable when that happens, and you're going to spend half of every day in the potty. It's just what's going to happen. There's nothing to do about it. Ripening, next term. Take a look at the cervix. We've labeled it for you right there. The cervix is the neck of the uterus. The cervix is what's going to go through all of the changes to allow for a vaginal birth. Today, moms, your cervix is long, hard, and closed. Again, about 36 weeks and on, as you approach 40 weeks or due date, the cervix starts to change. It goes from this hard structure, sort of like a stick of butter in the fridge, and moves towards a stick of butter on the countertop. So if you left that butter out overnight, you wake up in the morning and that butter is nice and soft. That's what the cervix is doing. It's actually preparing in advance for the delivery. Third bullet point, mucus plug. Take a look at it. We've put it right there inside the cervix. It's sitting up inside the cervix throughout the pregnancy, acting as a cork. So I really wrote this for you partners. The mucus plug is going to come out. When the mucus plug comes out, it means you have a matter of hours to a matter of days before labor begins. It's actually kind of helpful. You get to cancel appointments, who's going to take care of the dog, are the bags packed, making cookies for the nurses, getting things ready, because labor is coming. You have a matter of hours to days once that plug comes out. So why do I bring your attention to this, partners? She's probably going to call you in to take a look at it. Now, if she calls you in to take a look at it, and moms are going, really? And I'm going, yeah, really, she probably is. You're looking for a couple tablespoons of like egg white, streaked with some pinkish brownish blood. That would be the mucus plug. Could be a little surprise in her panties, could be a little plop into the toilet bowl. I'm just letting you know, it's gonna come out. When it comes out, you don't need to bring it to the hospital with you. True story, I had one roll into the hospital. They'd brought it in a little artichoke heart jar. We know what it is. You could just describe it to us. All right, partners, your takeaway. Plug comes out, labor is brewing. Yes? Okay, good. Next page.
Quick question.
Question.
The mucus plug, is that the same as your water breaking?
No, thank you. Clarification. Mucus plug really has nothing to do with the water breaking. It typically comes out first, and then down the road, the water may break spontaneously, or it may be broken for you. We're going to talk all about that. Thank you. Top of page 14, effacement. Effacement is talking about the thinning of the cervix. The cervix is about 2.5 to 3 centimeters long, as I mentioned, long, hard, closed. As you approach your due date, typically this cervix starts to shorten, starts to get thinner. As you move further into labor, it's going to get thinner and thinner and thinner and thinner. Once it's halfway effaced, then it's going to do what you knew it was going to do. It's going to start to dilate. We talk about dilatation in terms of centimeters. So you start off closed. Then the cervix starts to open. Starts with 1 centimeter dilated. 1 centimeter is about the size of a Cheerio. Then you are hours in labor, and you're going to get to 5 centimeters. 5 centimeters, about the size of a 50-cent piece, or a vanilla wafer, I would say. A little bigger than a 50-cent piece. Then labor's going on, hours and hours later, you're going to get to the big 10. 10 centimeters, about the size of a good quality bagel, Noah, somebody like that. When you get to 10 centimeters, what happens then? You push the baby out. You have to get to 10. I don't care if you've had friends or family tell you, well, I only had to get to 9. That's just not true. You have to get to 10. What 10 means, during a vaginal exam, they're reaching up, and they're actually reaching for your baby's head. You don't know this, but when we check someone's cervix to see how much progress they're making, we're literally touching the baby's head. We like to tickle the head, because when we tickle it, and if you're monitored, the baby goes, and we can see their heart rate changing, and that's a really good sign that your baby is happy on its way to being born. When you get to 10 centimeters, there's the nurse, doctor, or midwife reaching their fingers up, checking for dilatation. 10 means that the cervix has opened up all the way to that bagel and gone past behind the baby's head. So now what happens? You are going to push something the size of a cantaloupe through something the size of a lemon. And this is why they call it a miracle. And I'm going to show you the miracle up on the screen. We're going to drop a screen down a little later so you can witness the miracle for yourselves. Don't forget about the pushing. Sometimes people get so fixated on got to get to 10, got to get to 10. Well, you do have to get to 10 for a vaginal birth. Then you have 2 hours out of your life to push the baby through, right? Don't forget that part. All righty. Last item on page 14, bloody show. Not to be confused with what, partners? Thank you, mucus plug. Bloody show is a sign of progress. And partners, I need your full attention on this. I'm going to make a big distinction. When the cervix opens beyond 3 centimeters, 3 centimeters is about the size of a 50-cent piece. When you open it past, when it stretches and dilates past 3, it's literally opening beyond its capacity. So that tight band of tissue is stretching, stretching, stretching. Well, it gets tiny little paper cuts, little lacerations around that tight band. Little droplets of blood are now emitted from that tight band of tissue. Mixed in with vaginal secretions, mixed in with amniotic fluid. Now she empties her bladder. Now she wipes the toilet tissue. She's going to see a little bit of bright red blood on the toilet tissue. That's a sign of progress. The plug came out, labor began, hours are going by, and now it's to 3 and beyond. Little bit of bloody show. Some of you won't even see this until you get to the hospital. Others of you will see this at home. Partners, the distinction. Never will it be appropriate for heavy bleeding into the toilet bowl. Never will it be appropriate for the first day, like moms, the first day of a heavy period, blood dripping into a toilet bowl. That is not bloody show. That is a problem. Probably what's happening is the placenta is doing something it shouldn't do. This is an obstetrical emergency. Not common, not to be expected, but you need to understand the distinction. Bloody show, little bit on toilet paper versus heavy bleeding. The takeaway, anyone with heavy bleeding from this moment forward, that is a drive to the closest hospital. Don't pass a hospital on the way to yours. Clear? Anyone need clarification on that? Okay, good. And as I say to you, not to be expected. There are not a lot of obstetrical emergencies. You need to be aware of the distinctions.